Have you ever been told that nothing can be done for your vision loss, only to wonder if a forgotten therapy might prove otherwise?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're examining a compound that keeps resurfacing in eye health conversations, dimethyl sulfoxide, or DMSO. You'll hear documented cases, study results, and reader reports describing improvements that conventional care often considers out of reach.
I'm Alara Sky. DMSO is described as an umbrella remedy because it blends multiple therapeutic actions: tissue healing, anti-inflammatory effects, antimicrobial action, and enhanced microcirculation. It concentrates in delicate tissues like the brain and eyes, which may explain why people treating unrelated issues often noticed clearer vision as an unplanned benefit.
DMSO's history is turbulent. After its discovery in the 1960s, demand surged as reports accumulated across many incurable conditions. Regulatory pushback followed, and interest faded. Recently, renewed attention has sparked thousands of reader accounts, including striking stories of improved sight after years, or even a lifetime without functional vision.
The eye-specific claims span everyday issues and severe disease. People have reported fewer floaters, reduced eye strain, and better night vision, along with improvements in focusing problems such as myopia or presbyopia. Others describe benefits for inflammatory and infectious conditions, blepharitis, conjunctivitis, uveitis, and smoother recoveries from eye surgeries where adhesions can complicate healing.
A recurrent theme is pressure and perfusion. Beyond lowering intraocular pressure, accounts suggest DMSO may counter degenerative processes in glaucoma by supporting retinal cells and fluid dynamics. Reports also note relief for spasms or twitching, and for dry, blurry vision, symptoms that, while common, often lack satisfying conventional solutions.
Protection from injury is another pillar. DMSO has been shown to safeguard tissues from otherwise lethal stressors, including loss of blood flow. In animal models of retinal ischemia, DMSO reduced ganglion cell death. Readers have echoed this with narratives after optic nerve events or retinal bleeds, describing rapid clearing of transient grayouts when DMSO was introduced.
Light damage provides a second line of evidence. Multiple mouse studies indicate that DMSO preserves retinal structure and function after toxic bright light exposure. Corresponding reader stories describe recovery after extreme sunlight exposure and even accidental sun gazing, situations where conventional expectations are often modest at best.
Retinal degenerations bring the discussion to its most challenging edge. In retinitis pigmentosa, an inherited, generally progressive condition, early observations found that patients receiving DMSO for other reasons showed visual improvements. Follow-up work, including a larger trial enrolling people with RP or macular degeneration, reported gains in visual acuity and fields, better night vision for some, and an unusually high rate of disease stabilization when decline would normally be expected.
Macular degeneration, especially the dry form, appears frequently in reader reports. Accounts include improved chart readings, reduced visual distortions, better night driving, and ophthalmology notes of decreased scarring. While outcomes vary, the volume and consistency of these experiences have drawn continued interest in DMSO as a supportive measure for retinal health.
There are also uncommon but closely observed cases where severe or long-standing blindness partially reversed. Historical reports describe trauma-related blindness improving when DMSO was applied, including recovery of color perception and demonstrable functional sight during blinded testing. Contemporary anecdotes, such as vision returning in an eye blind since birth, mirror those early accounts and fuel ongoing investigation.
Mechanistically, DMSO may help by increasing microcirculation, reducing inflammatory cascades, dissolving problematic protein deposits, and enhancing drug penetration, potentially allowing lower doses of concurrent eye medications. Its ability to reach the retina and optic nerve is central, given how difficult it is to deliver therapies effectively to those structures.
Readers routinely highlight everyday visual performance, not just disease endpoints. Sharper focus, clearer contrast, fewer floaters, and improved night driving. Some report relying less on glasses. While such outcomes are subjective, their frequency across diverse circumstances is noteworthy and aligns with DMSO's proposed actions on tissue hydration, perfusion, and cellular stress.
Safety always matters with ocular tissues. The article points to studies showing no retinal or optic nerve toxicity at normal doses used in research contexts. At the same time, concentrated applications can sting and redden the eyes temporarily, an effect noted in early clinical experiences, so careful, informed use is emphasized.
The breadth of conditions mentioned is unusually wide. From genetic degeneration to ischemic injury, from light toxicity to inflammatory infections, that range matches DMSO's multi-mechanism profile. It is not presented as a cure-all, but rather as a tool whose unique properties intersect with several common pathways driving vision decline.
Stepping back, the article frames DMSO as evidence that some accepted limits in eye care may reflect delivery challenges and neglected approaches rather than absolute biological barriers. The conclusion suggests that restoring microcirculation and cellular function can, at times, rekindle visual capacity we assume is permanently lost.
If you've been told to expect only decline, the take-home message is that documented human experiences and controlled studies justify a closer look. The author underscores that many people who had done everything right saw progress only after adding DMSO, and that this pattern appears across other chronic conditions as well.
Here's your practical challenge for today. Review the longer discussion that expands on these findings and compiles protocols and references for floaters, cataracts, glaucoma, nearsightedness, dry eyes, strain, and macular degeneration. Then make a written list of the specific visual problems you notice most: night vision, contrast, pressure symptoms, or post-surgery issues, so you can compare them against the described evidence and decide on informed next steps with your clinician. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.